Ghairmeacha Rialáilte Cathaoirleach, and I welcome this piece of legislation and I welcome the opportunity to talk on it. And again, I thank the Library and Research Service for their detailed paper on it, and also the brief that we got. It has been very helpful. And it's been said many times what the bill involves, and there are really 6 kernel points that have been set out for us, and it proposes to give effect to the following amendments to the Health and Social Care Professionals Act 2005. And just for the benefit of people that mightn't have grasped what this is about, because I'm going to go around in a circle in a minute as to why it's necessary, and I'm going to mention the report following the Dr. Neri scandal, and then I'm going to come to the dentists who have identified serious gaps in the regulation. And you may be aware of this, Minister, in relation to Oranmore in Galway and what's been brought to our attention. So it's important to point out what's good. So there are 6 points. Ensure that social care workers applying for registration are required to meet the same standards as other professions registered with CORU. Very basic. Provide the Minister for Health to prescribe and vary the qualifications required by designated professionals. Very practical. We need that. And then amendments to the Medical Practitioners Act 2007, which I understand arose directly from the Neri scandal, amongst other changes you were trying to bring in. So in relation to that, provide that persons operating under the functions of the Medical Council will have appropriate immunity, which is absolutely necessary, and then provide that holders of UK medical degrees can access intern training posts in Ireland, absolutely vital. Provide for the continued provision of a route to registration on the General Division of the Medical Council Register for certain cohorts of internationally trained doctors. I'm not sure if I'll get a chance to come back to that, but it's something I'm going to keep a close eye on in relation to certain doctors, certain countries. And the final one, provide for amendments to support the performance of triage, investigation and adjudication of complaints under the Principal Act. Again, very important, and something that's clearly missing when we come to the Dental Council and what they're identifying in relation to their submission here that we all have now. So I welcome that, and I said I thank the work that's gone into this. I'm not sure why there's been such a delay. It's now 2022, and there was a health strategy in 2000, and then there was an act in 2005. CORU was set up in 2007, and we're still struggling to bring openness, accountability, monitoring, ensure competence, ensure that there's a proper complaints procedure that's able to deal with complaints in a way that's dealt with quickly and to the satisfaction of those making the complaints once they're bona fide complaints. So I'm not really sure about that, but it has taken this long to do it, and I'm not sure why. And I say that in the context of, let me deal with the inquiry, the Medical Practitioners Act 2007, just to give context to this, Minister, and I know you're multifunctioning again, and well done, and multifunctioning in so many roles. I have the report, some of the report before me of the inquiry set up that was signed by, Justice Harding Clark at the time. I think that was January 2006. And just to give perspective, because the Medical Practitioners Act came in 2007, and now we're seeking to amend that to make the system better. Just to give back in '98, a very brave midwife broke ranks. Of course, she was educated outside of the country, I think Northern Ireland or England, and she drew attention to the high rates of caesareans up in the Lourdes Hospital. And '98, finally an inquiry was set up, a non-statutory inquiry with 1 member, and we have the report from Harding. Now, I would advise every woman and man to read that report, because it highlights how this happened and how it could happen tomorrow, really, if we don't learn from it. If on the one hand our regulatory system isn't fit for purpose, and we're trying to make it fit for purpose, but secondly in relation to a duty to speak out, and you'll see when I quote from it why I say that. So it went from '98 up to when she published a report on the 25th of January. It was set up by order in 2004, so it just less than 2 years to report. And I'm just going to, while I have the time, which is unusual, I'm going to just read out what the inquiry established. It is a story set in a time of unquestioning submission to authority, whether religious or civil, when nurses and doctors were in abundant supply and permanent jobs were few and treasured. And the point being made about that was the medical profession were like this in relation to precarious employment, so there was an extra reason or an extra burden on them not to speak out or they would lose their jobs. And indeed, 1 or 2 brave souls that did raise questions found that their contract wasn't renewed. Now, this is not too long ago in Ireland in relation to this. So it's a story of unquestioning submission to authority, civil or religious. It is a story of a relatively small but very busy hospital which operated by a separate and a unique set of rules and was accountable to a religious community rather than to objective medical standards. And that's what we're trying to do here. And again, I'll come back to the Dental Council. Establishing the rate of caesareans carried out, unacceptably high, was difficult as key registers were missing. The numbers are truly shocking, and they're here. I won't take the time up reading out the numbers. This is the judge. The numbers are truly shocking. Now, and go forward. No one made a formal complaint and no one questioned openly, except the brave midwife that went along with her friend to the solicitor for the Eastern Health Board, and I want to compliment the man in charge of the Eastern Health Board at the time, who took the whistleblower's disclosure very seriously and followed up on it. That was the old Eastern Health Board, from what I can read. I never met the man, and I don't know. Goes on to talk about Dr. Neary's fall from grace, but I'm not going to go into any of that at the moment. Inadequate supervision. He came to work in a unit which lacked leadership, peer review, audit or critical capacity. It is the story of a doctor with a deep fault line which was recognised early but never corrected. But it's a story, in the judge's view, of a committed doctor with a misplaced sense of confidence in his own ability. It is a story of deep misunderstanding and misapplication of clinical independence. It goes on then to look at, these are the actual findings now, the consequences of it. And there was very little turnover of staff during that period. Job insecurity may have influenced a climate of silence. Consultants could and did cause nurses to be transferred. Many witnesses recounted to us that a junior paediatrician encountered Dr. Neary's displeasure, causing her contract not to be renewed. And it goes on then in relation to the statistics and so on. No one seemed to know the actual numbers or suspect that anything was amiss. And of course, we had the usual internal review by 3 colleagues who upheld everything that Dr. Neary did. They subsequently regretted that, and the judge says, acknowledges that they regretted that, but they upheld everything they did, and there was nothing out of the ordinary. And through all of that, the Eastern Health Board person persisted, as did the whistleblower, at a very, very difficult. I'm just going to finish with this now, because can you, doctors, Dr. Neary and O'Brien, were remanded on a number of occasions for rudeness or abrupt manner. One of the recommendations is that they would learn how to say hello and shake hands to the patient. So just to put it in context, very few midwives volunteered to speak to us. I won't read out that because The notes had mysteriously disappeared. A considerable number of those former patients were unable to have a review because the notes had disappeared and so on. Now, I mention all of that and more that I'm not mentioning. It was really worth a read in the sense of a blinding silence and a failure to recognise mistakes. So my point is that no matter what legislation or regulation we bring in, it has to be matched by courage, and more importantly, by the creation of an atmosphere that rewards people who come forward. And that is the challenge for every institution, and we're utterly failing. Within that context then, I go to Galway, not to be parochial, but because, as you know, Minister, a serious problem has arisen there in relation to an orthodontist. Currently, the subject of an application to the High Court, which I won't mention whatsoever, and we've been told about that. In the meantime, that person is not able to practice, I think by our own admission, not able to practice. So we have over 200 families affected at various stages of orthodontic treatment left in the lurch, and we've been all at the meetings in Galway. I know my colleague Deputy Noel Grealish has raised it, as has Sean Kine in the Shannon. So cross-party, we have listened to the concerns of the people on the ground who have been left without an orthodontist. Now, the point for me is, not alone is it terrible for the families, and they've paid money and lost it, and they have to incur additional expense. The difficulty is that the Dental Council, in a meeting with us, is telling us that the obligation is on that person who clearly can't practice. I'm not commenting on a court case. It's accepted that the person cannot practice. So therefore, how could the ethical obligation be on that person, be it a man or a woman, to sort out the problem when they're in trouble? So there's a huge gap here, and I'll be using the word gap in relation to dental services, which is very not helpful really, excuse the bad pun, but let me stick with this submission regarding legislative change in dental regulation. So we're being told that this Act is going to help with that, and I see a reference to the 1985 Act. For dentists, I see nothing since in relation to dentists. But let's look at the executive summary in relation to their submission, and they have an obligation to bring matters to the Minister's attention. So in their submission, the Dental Council is making this submission to the Minister under the section. It's obliged to advise the Minister on all matters. There are two gaps in the present Act, that's 1985, that pose a significant risk to public safety. Significant risk to public safety. The failure to oblige registrants to maintain their ongoing competence, and the failure to regulate dental practices. Patient safety cannot be assured, and patients have been harmed because of this failure to regulate. And they go on in detail to look at how this happened. Indeed, they mention Dr. Neary in terms of the 2007 Medical Practitioners Act. And luckily, unfortunately, we don't have the equivalent of a Dr. Neary in the dental profession, certainly not identified. However, I hope we don't need that to happen for us to take the appropriate action to update the Act from 1985, which we've utterly failed to deal with. While registrants, that's dentists going on the register, while they are ethically obliged to maintain an ongoing competence, this is not underpinned by legislation. And they go on then in this detailed report, which I have read, and to highlight 2/3 are not Irish trained. 2/3 of dentists in Ireland are not Irish trained, and that in itself is not a fact to comment on, except it makes it more complex to recognise the training and whether people are competent. There is no obligation to keep up with competency at all, legal, in this. And so we're looking at a strategy of back in 2000, which is 22 years ago, the health strategy, and since then we've got, you might remind me, SMILE, I think, the dental strategy, the SMILE and something. It's a bizarre phrase anyway for it. Yeah. Anyway, there are gaps, I forgot, there were gaps in my memory in relation to it. So I'm highlighting this today in relation to how could this be allowed to happen? What has happened since this was presented to the Minister back before Christmas, October 21, a year ago? A year ago. Was there any possibility within this legislation to make provision for this? And then I'll finish. I won't use up my whole 20 minutes. I've made my points. I just find it very difficult to have somebody from the Dental Council telling us, and I'm repeating now, that the obligation is on the dentist who is in trouble and clearly can't perform for whatever reason to take the appropriate action. That in itself is a major gap in the system. What is to be done about that? If somebody could give us an update on it, Ghairmeacha.